right, today I just wanted to explain a little bit about thyroid. Often I see thyroid really underdiagnosed, and maybe they don't have true clinical low thyroid, but it's below optimal. And this is really where customized wellness and what we do comes in, really the functional medicine component of things. This lab, I just got back and reviewed this today with a patient. She was complaining of difficulty losing weight or keeping weight off, a little bit of fatigue, a little bit of hair loss, cold, tends to be cold more often than she's warm, tendency towards constipation that, and a lot of these things she didn't even think to mention, but as we started kind of talking through it, we realized, oh, she does kind of have like several low thyroid symptoms. She also has anxiety, some high stress. So we really just looked at all of her hormones, her vitamin levels, her inflammation markers, cholesterol, etc. But I wanted to point today at this thyroid. So first of all, what we want to see and recognize and understand is these reference ranges that you see here. A reference range is a really broad target. Okay, so they're basically saying 95% of the population falls within these reference range. Therefore, anybody that's below this reference range would be considered low, and anybody that is high above this 95% median would be considered, high abnormal. Okay. Everyone else we're going to call healthy, except for they didn't ask anybody if they were healthy or if they had symptoms. So you just get this really broad range. So what we want to do is fine tune and connect the dots with symptoms and then find out why it's going on in the first place. So the thing here is we have the TSH. The TSH is a signal from the brain to the thyroid. And so here's a picture of the thyroid here. This is in your neck. And the first hormone that the thyroid produces is T4. Now, I like to look at the free levels of these hormones, so you'll see me do that. Free T4 here of 1.1. Optimal, I would call between 1.2 and probably 1.5 for a woman. That could probably be discretionary between providers, but definitely more narrow than this reference range, right? Okay, and then we have free T3, which is the second thyroid hormone that the body produces. And you'll see here, this kind of trees, right? We want the thyroid hormone to go to this T3 level. If it's piling to reverse T3, we'll get a high reverse T3 lab level that I'll look at sometimes. But we also just see this kind of clearly low T3 or below optimal T3. And that's really part of what we have right here is this T3 level should be between 3.5 and 5, a free T3 level. Let me clarify. All right. Now, what you're not seeing here on this picture, once the body recognizes the thyroid has enough hormone, a signal goes back to the brain, into the pituitary gland, and there's a biofeedback loop. And what happens is this TSH levels come down. So the higher the thyroid hormone levels are, the better they are in a sense, the lower the TSH will typically be. Now that's not always the case, but we do see that. So TSH is not an active hormone, but it does leave clues. So an optimal TSH is between 0.5 and 2 in most cases. If somebody has an autoimmune thyroid, sometimes we'll be a little bit more aggressive in lowering that TSH so the thyroid can kind of rest. But for the majority of people here, 0.5 to 2 is a good level to kind of see on that TSH. And again, it's not the end all be all. What matters the most is your hormones, but you kind of can use that as a little bit of indication as to what else is going on. All right, so this lady has a little bit of a high TSH. So she's got what I would call subclinical hypothyroidism, meaning that she's in reference range, but we're trending a certain direction here with these labs, and she's got symptoms, okay? So why does this happen, right? If we have a low T4, there would be some things that I would adjust and add to this, but I found this picture online of really kind of a functional approach to thyroid, and I thought, oh, that's really helpful, and can make it a little bit easier to understand, although I might put these in a little bit of a different order. You get the basic concepts here. A low T4 can be some of these nutrient and vitamin and mineral deficiencies, some stress, infection, toxins is a big one. that we cannot be making T4 because we have toxins in our body, okay? And then why do we not convert from T4 to T3? It can also be stress. A lot of times I will point again to toxins. So you'll see that kind of reoccurring theme, inflammation, and I would point to gut health with that. And I would point to these minerals, selenium, zinc, iron, ferritin. Looking at a ferritin level in the labs is very helpful. And iodine here also, okay? And then, yeah, that's kind of mainly what I look at there, right? So it's not that I don't give thyroid medication. In a lot of cases I do. I just want to see why else is it happening and try to repair that and heal that as I can. Another thing that happens is people have autoimmune thyroid, Hashimoto's, which is where these two antibodies here are present. And over time, if those antibodies go, the thyroid just doesn't make the same amount of hormone. It's kind of deteriorating. So it won't work at the same level as it did before there was Hashimoto's present, okay? So this is a basic recap of really what subclinical low thyroid looks like, what are some reasons for it, and just to kind of give you guys a picture of what it is we do at Restore You Wellness to try to help these kinds of issues. If there's anything we can do for you, if you have any questions, please visit our website, restoreyouwellness.com. Thank you guys.